Welcome to the webinar. This is called Perfecting the Practice Sample for Board Certification in Clinical Health Psychology, making it through from topic selection to finishing touches. Today's webinar is being presented by the American Academy of Clinical Health Psychology and the American Board of Clinical Health Psychology. Now, the latter is a member of one of the specialty boards of American Board of Professional Psychology. Now, the mission of the Academy, or call it American Academy of Clinical Health Psychology, or what we'll just refer to as Academy, it includes the recruiting and mentoring of candidates eligible for board certification in clinical health psychology and to promote the values and recognition of ABPP board certification. So today's webinar is a follow-up from a general webinar that we did that was presented by the Academy back in November 2018. If you weren't on that webinar, I would like to get that recording. It was recorded, and if you just go to YouTube and search ACHP webinar, it'll show as one of the top hits within YouTube. And that's a roughly 50-minute webinar that we recorded. Now, we're delighted to welcome our speakers today, who will include Dr. Nicole Najjar, who is the practice sample coordinator for the board, Christina Shook, who is board member of the Academy, Lisa Kearney, who is the president of the Academy, and my name is Dr. Mark Vogel. Now, some housekeeping things here. All attendees are in mute mode for this initial portion of the session, and their videos have been turned off. Our objectives for today are to understand some basic requirements of the practice sample submission, identify methods for selecting practice sample topics, reviewing tips for preparing practice samples, and then finally discuss some lessons learned from candidates that we worked with through the steps. Now, we hope to have plenty of time for discussion and questions near the end of the session. Now, there's two things. There's a chat feature built into Zoom where you can submit a question. You can either direct it to an individual, or it can go to all people. And during the open discussion period, we don't really have the raise the hand feature in this particular one, but again, we'll try to unmute people who maybe put something in the note if you want to say something in that period of time. Now, this webinar is also being recorded and will be available after the session is completed. All right, now I want to turn the controls over to Dr. Najjar, who is going to take it from here, and I'll let her have it.
Hi, everyone. My name is Nicole Najjar, and I am going to do the next section of slides. I am the practice sample coordinator for the Clinical Health Psychology Board. So let's see if I can get these slides to go here. There we go. Okay, there are two options for submission for clinical health psychology. Standard clinical candidate option and the standard candidate primary care focus. If you'd look at our manual previously, you may have noticed the professional portfolio or distinguished senior option. That's no longer an option as of 2019. So now we have these two options for submission for your practice samples. The standard candidate practice sample should reflect the candidate is practicing clinical health psychology at a specialist level of competency and should demonstrate biopsychosocial clinical applications of a broad range of psychological, allied clinical, and research literature. We'll take first the standard candidate practice sample instructions and go through these. Each candidate submits 2 practice samples. You will select between the areas of assessment, intervention, consultation, In the primary care practice sample submission, things are a little bit different. You still have 2 practice samples from 2 areas, still similar areas: intervention, consultation, management, administration, but the practice samples look differently. Intervention has 5 cases. So if you select intervention for practice sample, you will select 5 cases, 4 of which must be clinical health psychology with different presenting problems. So for example, chronic pain, diabetes. While 1 case may be traditional mental health, for example, depression. Each of the clinical health presenting problems must be different. The 4 clinical health psychology cases must be seen for a minimum of 3 appointments and should include primary care appropriate assessment and outcome measures. It should be clear how the candidate promoted and monitored the change. The upper page limit for each case is 3 single-spaced pages, not to include citations or appendix materials. You'll notice your consultation is different as well. So your consultation within primary care behavioral health model typically occurs over 1 or 2 appointments. So these are brief in nature and referral focused. Consequently, if a candidate selects consultation for practice sample, there are more cases required. 6 cases, 4 of which must be clinical health psychology, presenting problems such as chronic insomnia, chronic pain, diabetes, while 2 cases may be traditional mental health, such as depression. Further, only 2 of the clinical health presenting problems may be similar presenting problems. Aspects of assessment that occur within the context of consultation should be described. The candidate should also describe how you consulted with and provided feedback to your healthcare team regarding the patient's presentation and how you provided feedback to the patient, as in consultation. The upper page limit for each case is 3 single-spaced pages, not including citations or appendix materials that you may add. Similar to the standard sample option, practice samples must be within the past 2 years.
Hi, I'm going to jump in. Can everyone hear me?
I can hear you, Christina.
Okay, perfect. Thank you so much. I'm Christina Shook. I'm currently the treasurer of the American Academy of Clinical Health Psychology, and going to follow Dr. Nahar's wonderful presentation up with talking a little bit about some of the practice sample instructions. So the heart of your practice sample truly is the document that describes your work. And Dr. Nahar was talking about how you pick your cases, and we want to talk a little bit here about what you put in the document that describes those areas of your work. So you want to make sure that you include the theoretical and empirical bases of everything that you do within your practice sample. So this includes adding literature citations to help your readers understand why it is that you're doing what you're doing. So it's really critical that your readers of your practice sample understand why you did what you did and how you did what you did. So it's critical that you describe the rationale for any actions that you took. And this includes whether it was intervention, consultation, management, or administration. We want to know why you do the things you do in your practice. And it's also really important to make sure that you address any ethical issues that may have come up throughout the course of your work, and that you make sure you're attending to any cultural or diversity issues. Having that cultural sensitivity and cultural awareness in your practice samples is really important as well. So your samples should include relevant characteristics of the problem that you're presenting on or writing about. You want to make sure that you include any collateral information from other providers that you may have received throughout the course of your work. You want to really thoroughly document and describe your evaluation procedures, any assessment that you did, and also explaining any opinions, conclusions, or recommendations that you may have made regarding the patient, regarding your consultation. You want to be very clear and able to articulate that throughout your practice sample. It's also important that you talk a little bit about or write a little bit about how you complied with APA ethical and professional standards throughout the course of your work in the sample. So as part of your practice sample submission, you want to make sure that you include everything related to your work. So that includes a copy of the original report that you produced, any case notes you might have taken throughout the process, any therapy notes, progress notes, any referral notes that you might have received from, if it's, for instance, from a physician, you want to see the referring consult. If you provided or conducted any psychological testing or used any assessment measures, you want to make sure that you include those measures as well. And make sure that they're the measures that the patient or your client actually completed, not just copies of them. And also you'll want to include a copy of your informed consent document and the HIPAA documents that your clinic or your practice or your healthcare system utilizes. And of course, make sure you sanitize all of these documents so that there's no PHI included in anything or any way to identify the individual. Can I advance the slide? So on to picking your topic. This is always a question that everyone has. How do I choose a topic? And that process can be a little bit daunting at first, but it's actually not that hard if you break it down for yourself and you think about it. Some of the tips that we have for you are to make sure that you really select a topic that you're comfortable with, something that you do regularly in your practice, that you feel like you have a real command of the process. Make sure that you're using an area or choosing an area in which you know the research literature. Making sure that obviously you refamiliarize yourself as well and stay up to date. If you're using a practice sample that's a year and a half old within that 2-year window, make sure you check out the recent literature that's been published to refamiliarize yourself with it. Make sure that you're still on the right track with everything. And it's also very important to make sure that you choose diverse topic areas. So for instance, if you're doing a consultation and an intervention practice sample, and your consultation is with a physician about a patient with pain, you're not necessarily going to want to do an intervention case on a patient with pain as well. So make sure that you're choosing areas that are diverse and demonstrating that you have a breadth of experience within clinical health psychology. You also want to make sure that you're attending to any ethical or legal areas of concern that might be present, and you talk about those areas, that the way that you addressed any ethical or legal issues, or the way that you would address them if they became an issue in the case. And then also, again, attending to cultural diversity is very important. So if you can identify cases where anything like that is present, it's important to talk about that and present on that. Some more helpful tips. Don't pick your easiest case, but don't pick your hardest case. You want to make sure that you choose cases, again, that you're really comfortable with, that you're familiar with, but that aren't the easiest necessarily. But also, choosing your most challenging or sophisticated or hardest case is going to be challenging for you as well in the process. So it's always good to choose something you're familiar with, that you feel really good about, and you can talk thoroughly and in a more sophisticated manner about why you did what you did and really demonstrate that you understand how you approach these cases and that you have a rationale that's fairly sophisticated in how you treat or intervene. Also, make sure that any interventions or assessments that you're providing in the case match the guidance from the literature. So that's important to be able to document and demonstrate that you are using empirically supported treatments or interventions and that the theoretical basis for what you do is sound. If for some reason you had to veer away from what the literature might suggest, it's really important to document your rationale for why you may have had to do that in that case. Also, if you can, make sure that you select cases for intervention where you're utilizing some form of measurement-based care. It's always helpful to be able to demonstrate what measures you used, how you assessed the patient's progress, and what the clinical outcomes were. And being able to show that as part of your practice sample and include those measures in appendices is really helpful in the process. And last but not least, if you're providing management or administration, a description of your work there, make sure that you have an example that shows that you did a needs assessment and the outcomes that you utilized and how you measured your outcomes as well.
Thank you, Dr. Shook, and I'm Lisa Kearney. I hope you can see me on video now, but we're going to give you some very practical tips. So let me just ask y'all, and you can reply in the chat box, is anyone like really anxious about starting this off? Because I just want to normalize that. I was super stressed about this. Where do you start? Where do you begin? I remember feeling really overwhelmed, and I was really glad to have folks in my life who kind of assured me of like, you've got this. You do great work in health psychology. So just start off with that. Yeah, I hear someone, yes, anxious. Yeah, that's very normal. And I just want to say everybody feels like that. And if you don't, like, I want to learn your anxiety management skills. So just realize that's normal. You guys are doing wonderful work. So start with the beginning and with the end in mind as you start up. You know, so look first. The best advice we can give you is go to the manual and know what the manual is asking you. I mean, what's nice is up front, we tell you what's being evaluated. So you guys can go and take a peek at that and really start organizing your structure around what you're going to be evaluated on. That's one of the frustrations I often hear from folks is, you know, there's not a templated thing of everything that we need to write up or how we need to write it, or do you want it in this style? You know, what I would do personally is make my organizational structure very clear cut, that it's organized around the things I'm going to be evaluated on. And that makes it easy for those who are coming in to evaluate the practice samples. The other thing that's hard is, I found this hard, writing, like I assume that everybody knows kind of the basics of what I know, but sometimes that's not the case. So if I'm writing from a primary care psychology or integrated primary care setting, the reader may be someone who works primarily in transplant evaluations. So trying to realize you've got to articulate what you're doing specifically. So I think it can help you a little bit if you try to write like, someone may not have any background or knowledge related to you, to that specific area, so that you're showing people your knowledge in that way. And again, provide citations throughout as you're talking about any particular cases or assessment that you're doing, that you are, again, referring back to the literature. You've heard a few of us say that. That's really important, to state why you're doing something at a given time. I think that can be really helpful. The next is to be detail oriented. One of the things to go back through, and I know you're already stressed after you go and write all of these things up, but do go back for spelling and grammar, and yes, you know, APA style, when you have references, organizational, just work from an APA style. We encourage you to really proofread what you've done. You heard Dr. Shook say this again, but having seen some samples, make sure that all the de-identification has really occurred. Read through that, especially if you're the one de-identifying it. You know, some people have places that actually go through and they have a privacy officer and they work with you to do that. but that's really critical, and a key part of what we're displaying in competence is being able to keep everything private that needs to be private from our patient standards. And go back through. I'd encourage you, if you can have someone that is working outside your setting to take a look at it, make sure that other people will understand. I work in a VA setting, so I have all kinds of VAEs in everything that I do. My partners in the DoD, Department of Defense, often have that too, and I have to say, I have no idea what you're talking about right now. Try to write with the reviewer in mind that they may not be familiar with your setting, your acronyms, all of that. And then lastly, you may be working this over a year's time, and some critical things may have been published during the time related to the intervention or the assessment that you're doing. Go back at the very end before you submit and just do another lit review and make sure, okay, there's nothing new that's in here, because sometimes what's recommended has changed. And so you may want to address that, especially if you did something that is now there's not as much evidence for. Okay. Another quick tip is realizing that the Academy does provide opportunities for you to have mentoring. And when that happens is after you draft your samples up, your professional statement and your samples, you'd reach out to us. There's the hyperlink. Reach out to me directly. I'm lisa.kearney3@va.gov. All of that's on the website though. And when you have a draft, that's when we'll assign you a mentor, because we feel like people benefit most at that stage. If you got questions before then, feel free to reach out to me. I chat with people all the time by phone, and happy to talk with you too, or by email and answer some general questions that the manual may not answer. But at that time, mentors can meet with mentees. Well, it takes a couple of weeks, week or two, to kind of get us connected, what mentors are available for you. And they'll read through your drafts and then provide some feedback to you. I do recommend, sometimes I have folks who contact me 2 weeks before their stuff is due, and that's really difficult for a mentor to give you any kind of feedback at that point. So try to, get it done with 3 to 4 months ahead of your deadline, so you've got some time to work with a mentor and give you some input. Remember, they can't do line by line editing, but they will provide you some overview feedback of how to strengthen and improve your sampling. So here's just some quick lessons learned, and then Dr. Shook, I'm going to call on you to help me with the chat box and see what kinds of questions we didn't answer yet, and Dr. Vogel will take us home at that point. So lessons learned, go back again as you're submitting, remember what you're being evaluated on, go through that checklist of different items, make sure you have clearly articulated that in the practice sample. Again, we highlighted this. Go back and do a quick lit review, make sure nothing has changed. And again, cite the literature to support what it is you are doing. Go back and do a last proof one last time. And last but not least, I'm horrible at this, y'all. I'll just say it. I really always underestimate how long something will take me, because I think I'm way more brilliant than I am. And so I think, oh, I can get this all done in 30 days. Start now. If you just became a candidate, then start now. Start outlining, start picking your cases, and chunk this over time. You certainly can do it in a shorter period of time, but let's just say it's not as pleasant an experience as if you do it a little bit over time. The other thing, I talk to a lot of folks who get revise and resubmit on their practice samples. And I would love to just tell y'all, it's okay. Part of the time, revise and resubmit means you need to articulate more about what you're doing. They didn't quite understand different things. You didn't maybe cite as much to support you. Think of it kind of like when you submit something for publication. I mean, how many people have ever gotten a automatic, we are accepting this article? I would love to meet you and you can coach me in my writing for my other articles. There's not a ton of people that happens to real regularly. So realize it's not uncommon for people to get a revise and resubmit. Doesn't think we think you're terrible, doesn't think anything like that. A lot of times is we need more information. So just kind of get your cognitive space around that done. Remember, you need to probably provide more detailed information if you get a revise resubmit, and really work back to attend to what the reviewers are telling you. This is also a good point. If you didn't get a reviewer before this point, mentor before this point, go back and get a mentor now, and they can help look at what the reviewers are telling you and say, well, here's where you might want to expand some more. This is not so clear in your sample. Don't forget to show your competencies as a health psychologist. You know, we do want to see you talking about the different medical disorders that you're addressing. We want to hear you talking about the medications, how you talked with the primary care physician, how you talked with the referring provider. You know, make sure that it really shines through the specific competencies from health psychology. And you can go back and read in some of the key articles about what those competencies are and say, have I highlighted this? And not just treatment of depression. Remember, you've got to not just share what you do, but why you do it, and being very clear in your write-up about that. And those are some of the basic things that we see that kind of can trip people up over time. So we wanted to give you a few tips about where to go. One is our Academy Clinical Health Psychology website. There's lots of links on there with resources for you. We're starting to expand our YouTube tutorials. So we have a larger presentation that we did this last fall to talk you through all phases of the process, not just this one, and that's been uploaded. The four of us, our email is there. Dr. Nahar is the last one, that American Board of Clinical Health Psychology 2013 at gmail.com. But we're really here to support you. So Dr. Shook, I wanted to see, I know some questions came up while I was presenting this material. Would you mind letting me know what I didn't answer that I could get to, and then we'll turn over to Dr. Vogel to open it up to the group. Nope, we may have lost Dr. Shook.
I'm here. I'm not sure what happened. I got kicked off and I'm back. Sorry about that.
That's okay.
I believe you were just asking me about the chat box and some of the questions that came up, right?
Yes, ma'am. Is there anything that I didn't answer that you wanted to make sure that I or you commented on?
Well, I think that was a really good question that was raised about the making sure to have citations within the document. There was a question as to whether or not that was applicable just to the professional statement or to the practice samples. And I gave an answer. I just wanted to make sure for that person that it made sense. I had suggested that the answer really is both. It's important to have them within your professional statement, but also within your practice samples. And it varies as to what you're going to put in those two documents, but there is some overlap, because certainly in the professional statement, you're talking about what you do and your experience and who you are as a clinical health psychologist. And often you need to weave in the theoretical underpinnings and your approach to care and treatment and your outlook, and all of that should have evidence woven into it, because there's an empirical basis to everything we do as clinical health psychologists. But transitioning back to the practice samples, I was thinking about, if you're doing an intervention case, for example, on a patient with pain, you're going to want to make sure, if this is your practice approach, obviously, you're going to want to make sure that you're citing, you're talking about, CBT pain, for instance, and what the theoretical underpinnings of that, and why did you choose that approach, and what manual did you use, and what assessment measures did you use, and the biopsychosocial model of pain, and maybe you talk a little bit about the gait neuromatrix, and you're going to need to be able to provide the evidence or the citations related to all of that information.
Mm-hmm. Excellent. I'm so glad that you addressed that in the chat box and right here, Dr. Shook. Thank you. So we are going to turn over to Dr. Vogel, because now I believe we're going to be able to unmute lines, because we wanted to give you all lots of time to ask specific questions. So over to you, Dr. Vogel.
The other question that came in earlier is individual asking about the time commitment and how to work that into your schedule. And Dr. Kearney, I think you addressed that a little bit in terms of, chunk it over time, try to think about it as an ongoing process. But anybody in the panel want to speak to that a little bit further?
I find the same thing. This is Nicole Nahar. I think finding time is really difficult for all of us, and know that the board is aware of that as well. So we are with the Academy side by side working with mentoring and trying to get you all to feel like you have the time to put in something that you feel pleased about. And so what I did when I went through board certification is kind of worked in between things in the evenings, weekends, things like that. And then once things looked like they were coming together, putting it through to other people to start reading and looking at it, and be planful, sort of like with a submission of an article or with a dissertation or research project, that it does take some time to kind of let it come together in the way that you want it to. So it's kind of balancing that patience with feeling good about what you're going to submit. But I definitely felt that too when I was going through board certification.
And I would just offer that it's, as anything, it's easy to procrastinate if there's no, kind of set deadline. And so I find that it's helpful to create some either, time where you set aside to work on that, but also you're doing it kind of a little bit at a time and not trying to just cram it, because it will be a much better project if you spend some time working on something and then reflect back on that and then return back to it later on. So we have a couple other questions. Differences regarding board designation between primary care versus standard board certification other than the requirement. For example, is the certification itself any different? And the answer is no, you're still board certified in clinical health psychology, and there's no difference between that, one versus the other.
And I also see a question in the chat box about organizing the materials, and this is one that frequently comes up for us in practice sample submission. Part of organizing the materials has to do with individual differences in the way that we organize our work samples. So we don't have samples with specific headers or specific areas that you need to organize your materials into. But one thing I can provide for you that was helpful to me as I went through and helpful to other candidates when they come to the practice sample phase is to look at the manual, and in the appendix, it's page 28 for standard sample and page 35 for our primary care focus. There is a copy of exactly what your practice sample reviewers use to go through your materials and check for competencies. So that may help give some organization and some shape to your practice sample submissions. You can use that to make sure also that you have the components that your reviewers are looking for. You can side by side it right with your materials to make sure that you're showing and demonstrating competencies in those areas. So that may be helpful to you.
All right, we have one more question about how long does it take from the time you submit materials before you sit for orals?
That's a great question as well, and the short answer is it varies. The longer answer is from the time that you make it through the first phase of reviewing credentials until the time that your practice samples are due, varies for each person when they actually get them in. So once your practice samples come into us, we have up to 8 weeks to review your materials and get those back to you. Then, as Dr. Kearney alluded to, a lot of times there will be some sort of revision process to make sure those are exactly where you want them to be. And if you get a revise and resubmit on your initial practice sample submission, then you have 6 months to revise and resubmit, depending on when you get that in. It will be reviewed again, which starts the clock for another usually 4 to 8 weeks to get that back to you. And then you are, if your practice sample passes, you get to select a date to sit for orals. Orals right now are twice a year, I believe. Is that correct still? Yeah, I see.
3 times.
3 times.
3 times. Thank you. 3 times a year. So it depends on what seats are available for those. So it can be pretty variable. And it also depends on how much time you might want in between completing practice sample submission and making sure you're prepared for your oral exam.
All right, so we had another great question, I think, that comes up a lot. Are we allowed to submit practice samples from cases during a postdoc fellowship, or must the examples be from independent practice?
Yes, from independent practice.
And my understanding is that the issue about postdoctoral fellowship is that you're really under the supervision of someone else at that time. And so it can't be a case where somebody else was truly supervising the case while it was being, as you're providing the services.
Correct. And if you're farther along in your career, also some people have asked about, can you submit samples that were actually completed by an intern or a resident that you were supervising? And that is also something that we don't do. So it's your practice sample.
And then the next question about being able to submit 2 assessment practice sample reports, or is it recommended to submit 2 different types of samples?
Good question, because you do have to submit 2 different areas of competencies. So you would not be able to select 2 of the same type.
Again, we do have the ability that if someone wanted to be unmuted, or they could potentially unmute themselves, I think. But maybe if you submit in the chat box, you wanted to be unmuted for a more, didn't want to type out your question, we could have you describe, give your question to the group that way.
Hello, I just have a quick question about the personal statement. I think on the candidate manual, it says the personal statements are around 10 pages at least, but it doesn't really give an upper length for them. So I was just curious about what the typical range is for the length of personal statements.
I don't know that one. I don't know if there is a range for it. I'm not sure.
I think probably that the 10 is an average, and really, as long as you are hitting all of the areas that are asked of you, and you're being comprehensive, and you're able to describe your work thoroughly and the theoretical underpinnings of what you do and why you do it, and talk about who you are as a clinical health psychologist, it's whatever length that takes you, to complete that. Maybe some people do that in 6 pages and some people do that in 14, but sort of depends on how concise you are and how verbose you are. But I think on average that 10 is a good target to aim for.
Thank you.
So if someone submitted the question about different practice samples, and this person says that they only practice in one area clinically, most of my work is research, what would you recommend in terms of submitting varied samples for that particular situation?
I can give that a stab, Dr. Vogel. I think one of the things to consider is where you're practicing clinically, can you give some diverse diagnosis at least that you're treating? I think that's important. But, if you're just, looking at it, since you're doing research too, I'm curious if you have some possibility to do like a program evaluation type of aspect that would be combined with the work that you're doing clinically, like a clinical intervention case that you're doing. So there's some different options. You do have to show at least 2 of those different competencies that we went through at the beginning in different areas. And so trying to think about how can I show diversity in the diagnosis. It may not be as wide range as other people, but to be able to make sure that there's differential there, and that you have some, I would imagine you still have some opportunity to look at consultation that you've done with a team member, as well as like a clinical intervention case, or doing a type of program development with a needs assessment and evaluation. So there's some fluidity with that.
All right, so we also had an example about what would an administrative management case sample look like. And someone else has also talked about doing program development sample and an assessment sample that are both in the same topic area. So similar kind of questions.
Sorry, I was trying to figure out how to unmute there. Everybody's like,
You got
"Oh."
it. I thought you would want to speak up on that, Dr. Nahar.
Taking the first question, they're moving up. So I'm sorry, I'm not super adept at this, as you might notice. Okay, what is an example of an admin or management case sample? So some of the things you might want to do, again, is review those reviewer forms that show the competencies at the end of your practice sample manual or our manual. And so some of the components are, management administration sample might look like a program development project that someone is doing. So if you look at the components for management administration, it includes a needs assessment with program outcome evaluation. It includes implementation of the program, and it includes the outcome evaluation of the program. So it gives you some idea and some guidance of what all we're looking for in that kind of a submission. Hopefully that answers that question. Well,
Right. So, I mean, the other question was really about doing a program development and an assessment sample that are both in the same topic area. Question is this not recommended?
correct, that is not recommended. What we want to see for your competencies is that you're able to practice clinical health psychology across different modes. So like program development and assessment, but we also want to see the variety of ways in which you're able to apply that in different topic areas. So you're going to want those to be in different topic areas.
And then the person indicated, David, talked about a survivorship care plan for cancer patients. Would that be more an administrative sample or a program development sample?
So the management administration practice sample submission incorporates program development. So yes, is the answer. First of all, great that you're doing that. And also that fits right in that management administration practice sample.
And then how about teaching samples? So someone who works at a residency clinic and they do a lot of resident education, how would that look?
So your resident education, I believe, and please other members correct me if I'm wrong, could possibly be under management administration if you did some program development in that teaching residency program. So
I'm sorry, Dr. Nahar. I was going to add to that if you developed something related to that residency program that was your own original work, I think you could make a case for putting it in there. But it would have to be something more robust than just developing a lecture for residents. I would think it would need to be some type of like a year-long course or training or educational experience that was rather unique that you developed on your own. I think a nice place to put something like that would actually be in your professional statement because that's a really a wonderful and interesting area of your work, and to be able to talk about what you do there in your professional statement would be a great place to put that as well.
Yeah, and again, I think the issue would be this is something you've done independently. So maybe if you were in a residency program, making sure this wasn't something you did as part of your training, but you actually created a piece of curriculum or how you were going to teach one particular area to residents, that you had a role in kind of making something unique and independent. So we had a question about if you only work with, for instance, diabetic patients, only one disease, but in other situations the person saw all CHP cases. So how would you do a practice sample where your current population was more limited in disease type?
And we do get this question a lot also because there are a lot of subspecialties like oncology or pain, and similar to what AG is talking about with one disease type. And our recommendation is typically to look at the cases that you treat, because you treat diabetes in different ways. So you might be treating diabetes, but you might actually be working with someone around medication management in one case. Where you might be doing an assessment for some sort of pre-surgical evaluation for someone with diabetes in another case. You kind of have to think creatively about the way that you're demonstrating competency to treat different areas of clinical health psychology. So while it might be diabetes, you might be there's several different things that are under that umbrella. There's weight management, there is medication adherence, there are pre-surgical or different kind of medication change evaluations that we do. So and there's also administration program development that you might do that might look different. So trying to be as conscious as you can that you are demonstrating competency to, even insomnia might be included in there too, to treat different areas under the umbrella of diabetes, sure, but it might be a different way that you're coming at it, if that makes sense.
And then we had a kind of follow-up from the program development. If a needs assessment was required prior to doing the whatever unique training aspect. And so the question is, do you need a needs assessment prior to doing some kind of program development?
So yeah, if we're looking under the management administration competencies, the first competency is to provide rationale for the program. So one example is a needs assessment, and that you conduct program outcome evaluations and you're considering relevant stakeholders. So you have to demonstrate that competency in your practice sample. So if that's a traditional needs assessment or in some other way providing rationale for the program and what your outcome evaluation will be and who the stakeholders are for that program, then you will meet that competency.
Well, our questions are dwindling down. If there's anybody else who wants to be unmuted or want to unmute themselves and ask a question, we're open to that. We have about 7 minutes left. Someone asked about, will the slides be available? What will be available is the whole presentation in a recorded format will be uploaded. I don't know that we have plans to distribute the slides, but we can certainly figure out how to get that to a PDF so everybody can get a copy of that as well.
The one thing that I would like to say, Dr. Vogel, if I could, is I know it was already mentioned, but I just want to highlight this because it happens so very often. I just want to highlight that original notes are your actual notes from your cases. So cut and paste into Microsoft Word or any other version that is not your original case note is not accepted. So that'll just save you some time. We do send out once you submit, we do send out a checklist so you can double check your submission and make sure you have all the components before we start getting reviewers for your cases. But I might save you some time there if you just keep that in mind. That's a frequent return issue for folks because you have so many things to think about that is kind of on the back burner. So if you have to go through privacy or some other way to make sure your notes can be sent with your packet, you can do that before it comes through.
Hi, this is John Bluestar. I'm stuck on a previous question if you don't mind. So it appears that you can apply for certification after 1 year of CHP fellowship. And I'm actually going into my 2nd year, so looking forward to doing that. But I was also thinking about cases I've recently have or cases I might want to have for my practice samples in this 2nd year. But if I'm understanding correctly, while I'm supervised, which is true, I have a clinical supervisor, I am doing I'm doing the actual clinical work myself. I am not able to use those cases, is that correct?
That's correct.
So when applying for candidacy, you're getting ready to then think about samples to have after the fellowship is completed.
Yep. Yes.
Got it. Thank you.
Mm-hmm.
And just one more follow-up question about the documentation and including original documentation. If the documentation is in the electronic medical record, I guess I'm trying to clarify, you want us to have an official way to print that out as opposed to copying it into a Word document? Is that what you were saying?
Yes, that's correct. So folks will sometimes print and de-identify. Sometimes they're able to have those stay digital, but have their privacy officer go through and remove material. It just depends on the individual site.
Okay, so just to clarify, if you print it out, so that, I guess in my electronic medical record system, you can print out the notes directly, but it sort of kind of looks like that of a Word document. So would you just, I guess, scan that back in?
Mm-hmm.
Okay.
That's what some folks will do, yeah. Mm-hmm.
Okay, thanks.
And mine came back too for that reason when I sent it in, and I didn't really fully understand completely. And so if something is cut and pasted, some of the material in that can be modified. And so what we want is we want to see exactly what your notes look like. So I'm not saying that anyone's going to do that, but it just, that helps kind of keep everything the same across the board so that everybody's notes are what they put in originally. So I had the same questions when I was doing it too.
So here's a question. Can you give an example of a consultation practice sample?
Mm-hmm. So a consultation practice sample might be something like if you work consultation liaison at a hospital and you are called in on a case for a patient that is refusing some sort of treatment, and you're going in to make sure that they are aware of all of the issues that might occur if they didn't receive the treatment, and that they have full capacity to be able to make that decision. So when you go in to do that consultation, you're actually consulting, you're meeting with the patient, but you're actually consulting back to the team to say, this is the best way to work with this patient. This is what patient expectations are. So the bulk of a consultation practice sample is the consultation with the patient, but also with your team, whatever that team looks like. So that's how it gets into a longer discussion about why you chose to consult in the way that you did, what you came up with, and how you presented that, which is largely psychological content to a medical team. Hopefully that answers your question.
And Nicole, just to clarify, what I'm thinking also in primary care, if you had a consultation that perhaps was a patient you followed over time, and so you had maybe an initial interaction with as a consultation request, and then there was a follow-up, and so you really could track the longitudinality of the care you provided and the ongoing consultation, so that it wasn't just a curbside consult you did with a physician and then you're trying to write that up. It would really be something more robust than that, correct?
Yes, and we have to, I think the confusion comes maybe between consultation and intervention at that point. And so what I always recommend is if you are writing it up as a consultation sample, that you make sure to include the consultation back to your other colleagues or to the team. And so if you're only discussing the work with the patient, then that's probably more of an intervention sample. If you're discussing the consultation back to the team, then you're into consultation. So hopefully that helps.
I had one more quick follow-up question. The practice samples need to be done within 2 years. I just wanted to clarify, is that 2 years from the first time you actually apply, 2 years from when you're actually approved, or 2 years from when you actually submit your practice sample?
Great question. Yeah, it's 2 years from when your credentials are approved.
Thanks.
You'll get a letter that says you're approved at a certain date, and that really is what starts the clock. All right, well, we're pretty much up at the top of our hour. Dr. Kearney had to step off, that she had another call she had to get on. So on behalf of all of us, we're really pleased you guys, we had a good audience, maybe up to 50 people who were attending today. So hopefully you've gotten lots of information from this. You can see all of our emails on the screen. If you have any questions, you feel free to reach out to any of us. As I said earlier, this webinar will be posted later on in the site. So if you go to the American Academy of Clinical Health Psychology's website, you'll find links to that. And again, also check out some of the other video tutorials that have been posted there previously. I think those could be very helpful to you as well. So on behalf of all of us, I want to thank you. And if you have ideas for future webinars that you think would be helpful to continue to promote this, let us know, and we'll continue to produce these as long as they're found to be valuable. Thanks for attending.
Thank you.